Good evening. Welcome to Facebook Live. Kim here on the sidelines at Berkeley Prep High School with Dr. Seth Gasser, sports medicine specialist at Florida Orthopaedic Institute. We are on the sidelines of the game. We're going to give you some injury prevention tips tonight, the topic being overuse injuries. Dr. Gasser, how are you?
I'm great. How are you?
I'm doing good. It's actually nice out. In Florida, it's really hot, so it's nice to have a breeze today. So tonight we want to, again, talk about overuse injuries. If you have questions, please comment below, like the post, share it on your page. We'll get as many answers as we can for you from Dr. Gasser. So, an overuse injury, for those of us who don't know what that is, define it for us.
Okay, well, let's back up for a second and get to injuries in general. So really there's two types of injuries. There's acute traumatic injuries, which are usually very obvious to both the patient and the physician and the trainer. And then there's overuse injuries, which are more subtle and less obvious, that are not related to trauma,
Okay.
as we think of trauma, but they are related to repetitive microtrauma, which is small trauma that is repeated on the same area over a certain time period to the point where they become symptomatic.
Okay. So when you say acute, are you saying that is trauma?
I'm saying an acute injury is something where you fall and land on your outstretched arm and your forearm's deformed because it's obviously broken. Or you twist your knee and you feel a pop and you tear your ACL. So you know at an exact point in time that you had an injury and you're hurt.
Okay, great. Thanks for the clarification. So what kind of overuse injuries occur in our football players, maybe our cheerleaders?
So most of the overuse injuries we see are in the lower extremity, especially in football players. They include things like tendonitis, shin splints, strains, those sorts of things. Cheerleaders are a little more prone to get upper extremity overuse injuries because of all the tumbling and use of their upper extremities, and they can have things such as, if you're young, you can have an injury to a growth plate from repetitive microtrauma. You can get tendonitis in your wrist or your elbow. Some really common examples of overuse injuries are things like tennis elbow or jumper's knee.
Okay. And how does a student athlete know if they have an overuse injury? You said that it's not something that happens instantly, so we're pretty late in the year now. They've been practicing, playing a lot of games. How do they know?
So typically what will happen is the student athlete will develop pain and swelling in the area of overuse. And initially it'll just be after activities. And what can happen is, as the symptoms worsen and they continue with those repetitive activities, they'll start to have symptoms with everyday activities and just normal daily things. And that's the time you really need to probably get concerned and seek some specialty help.
Well, that was my next question. How severe, how long do they deal with the pain? Maybe they're trying ibuprofen, Advil, putting ice, resting. When do they make an appointment with you or another sports medicine specialist at our practice?
So that's a great question. And really, when the symptoms become severe enough that it interferes with their ability to perform effectively in their sport, or they start having symptoms with daily activities, then it's probably time to see medical help.
So being a student athlete in the past myself, I love the game. I don't necessarily want to tell mom and dad that I'm feeling some pain or maybe not performing at the best. How would a parent know? Is there a way for a parent to know?
Well, I think a parent or a coach will know, because your performance in your sport will decline, and eventually you'll start complaining because it bothers you bad enough and you can't hide it anymore. But just the symptoms will affect your ability to perform at the level that you'd like.
Okay, answers that. Now, say that they come in and it's very severe. Do they have to do surgery? Is that always the case? Or what are the treatment options, conservative and non, once they see you?
So most of the overuse injuries are best treated with non-operative therapy, meaning no surgery. And usually it involves things like modifying your activities to decrease that repetitive stress. It may or may not require that you completely stop participating, but maybe change your practice habits and your training habits. A good rule of thumb is the 10% rule.
Okay.
So most of these are training errors, these overuse injuries, where you're doing too much too soon. You should not increase the intensity of your training more than 10% a week, whether you're a runner, it involves distance, speed, weights lifted, etc. So that's a good rule of thumb, a 10% rule.
Okay.
And the other way really to prevent overuse injuries is not to play the same sport year round.
Okay.
Okay, so most studies show that if you participate in one sport 12 months of the year, you are at significantly higher risk for an overuse injury, and you should take 3 months of the year and participate in either another sport that will stress your body in a different fashion, or just rest.
Okay, so to prevent any of this from happening, it sounds like they just need to change things up throughout the year, and again, not do the same repetitive, not play every single day with maybe they have a parent who's really wanting them to perform better, they're playing in their backyard. Those are things that you decrease whenever you start to feel these overuse injuries, correct?
Correct, that's absolutely correct.
All right, I think
We have a question here.
Sure.
A viewer wants to know, how do I prevent shin splints?
Ooh, great question. I used to get these all the time when I played soccer. So how do you prevent shin splints?
So most times people get shin splints, it's from a training error. It's usually secondary to running. So a couple things. Oftentimes they have some tight muscles in their lower extremities, whether it's their quads, hamstrings, or gastroc, your calf. So good warm up and stretching is important. And that's where really the 10% rule comes into play, because usually it's a training error where they're doing too much too soon. So the body needs time to adapt to increasing stress in an area where it can rebuild things instead of just breaking them down so they don't become symptomatic.
Great. And last but not least, can an athlete come back and play at the same level of competitiveness if they suffer from this injury?
So for the vast majority of overuse injuries, athletes come back to the same level. The key is to learn something from your injury so you don't have more overuse injuries in the future.
Great. Thanks, Dr. Gasser. Is there anything else you want to add about these injuries?
Nope, I think you did a great job as usual.
Thanks, Dr. Gasser. All right, to everyone out there, have a great weekend. If you want to schedule an appointment or have interest in visiting one of our sports medicine specialists, please contact us. Go on our website, floridaortho.com, or you can contact our scheduling line, 813-978-9797. Follow us on our social media and share this post, of course, for others to view. Thank you and have a great weekend.